For example, in Kenya, we do have a faith sector working group that is housed at the National, we used to call it National AIDS Control Council. The syndemic thing has never settled there. And within that space, we were able to come up with an action plan that was anchored in the National AIDS framework, National AIDS Control framework, drawn from the National AIDS Control framework. And that specific national action plan, the faith-based have been implementing it, and part of it, there are conversations on how to engage on issues of pediatric HIV/TB treatment. And a lot is happening. Thank you.
Okay, thank you so much. Let's give her a round of applause as she goes back. That is amazing work you are doing out there in communities. I'm giving 1 minute to the...
And do you know why they succeeded? Because the government here allowed them to use the safe approach. There are governments which are still stuck on the ABC. But ABC is so limited. First of all, it is inaccurate, but also it is inadequate and so stigmatizing. But when we worked with WCC, UNAIDS, and World Vision and others, INERERA was able to design this strategy that helps people to benchmark. And the government of Kenya has to be thanked that they allowed the faith sector to say, okay, if you have your framework that works well for you, do it. And they did it, and that's the results you are hearing.
Wow, wow. Can we clap for the government of Kenya? And for hosting us. Where are the Kenyans that are hosting us? Kudos to you, kudos to you. So I'm going to go to Elizabeth in 1 minute. Can you tell us in what ways can religious teachings and values be aligned with public health messaging to promote pediatric HIV treatment, care, and support without compromising faith principles?
Okay.
In 1 minute.
Okay, so we had a program by WCC in my country, Nigeria, and it was about living with HIV in the family. So there's this, we launched a book together with ICW, and in that book we have simple ways with very basic languages that can be used, and we had different faith leaders, community leaders present, so they can take back these messages to their followers, because every child, every parent, everyone belong to a religion or the other. You could be Muslim, Christian, or any other religion. And so we know that when you get to these religious leaders with these messages, they can easily pass it down to their followers because they believe so much in them and they listen so much. We all listen to our religious leaders. I have one that I listen to and I go to for counseling. So that's the first approach. And then secondly, we have plans to take these messages ourselves to gatherings, religious gatherings, with the help of these religious leaders as well. So we can just attend the services or the masses and just use a few minutes to, talk to them. So it doesn't look like we're just sending the religious leaders and then the people are just there behind the scene. And also they can actually see, and then we tell our true life stories to these people so they can see that, okay, this thing is real, because most of them still don't believe that there's HIV or that HIV can be transmitted through from mother to child. So we go ourselves, we tell our messages, our stories, and this has also encouraged a lot of them to actually come out and say, okay, we want to help with creating these awarenesses. And it has been very, very helpful.
Thank you so much. There is a friend of mine who was asking me a question, I think, last week, and she was saying that there are so many religious leaders who are living with HIV out there, but how many of those religious leaders come up to say that they're HIV positive, apart from Canon Gideon? So they are suffering in silence, there's the self-denial, and I'm glad that you are working with them. And it's very important for us to go and, even means looking for them in their churches. Let's go look for them, engage them, because without the religious leaders, I'm sure we might not take strides that we want, because they're influential in our communities, right? All of us here subscribe to our faith, right? Exactly. So that is how important it is for religious leaders to be on board. Yeah. Let me come to you, Shalik. How can partnerships between religious institutions, governments, and international organizations be strengthened to ensure faith-based actors are fully engaged in achieving the targets set out for the Vatican Rome Action Plan? In 1 minute.
Basically, all we need is champions. Yeah. Like we had a barrier, especially, we have a church in Kenya that is called Repentance and Holiness, and it's all over the world. But for us, the problem was people stopped taking medications once they go to the events, the prayer sessions. Then they come, and then after some time they're sick, they're missing appointments. They go for testing at other places. Thanks to EMR, we're able to track them, because the moment there's something called NOPI, it's a National Unique Patient Identifier. Once someone feeds the ID, it's able to tell you this client is on care at a particular place. So we have the data. And we decided, no, we can't keep fighting against faith. We need to work with faith. We have clients who are virally suppressed, living positively with HIV, but praying. We have Muslims, we have Indians, we have almost all the religions. What we need to do is have them as the champions. We don't need to fight against, but work with them. Respect each sector, know the boundaries, understand the policies, then merge what you can. But what cannot be merged at your basic level, let it be merged at a different level. So I think for this to work better, just have champions from each sector, respect the policies and boundaries, disagree to agree, but the root at the baseline, let's have the patient as the denominator.
Wow, thank you so much. And indeed, you can stay with the microphone because you're going to give us your closing remarks, your parting shots. And indeed, it's very important for us to partner with religious leaders. You can agree with me or not, religious leaders are influential. And some of them are telling our people, don't take the medication. I'm going to heal you. Take this water, take these beans, take this rice. You're going to be healed. And we are seeing this happening. In my country, there is a pastor who died of AIDS because he was in self-denial. I'm sure, Reverend, you know Pastor Iga. He died of AIDS, and he was a very big pastor. But because he was in self-denial, he thought God is going to heal him. And of course, if he thought like that, that means even his congregation of over 1,000 people were also being misled not to take medication. So it's important for us to partner with these health workers to see that we save the next generation, also achieve our goal of ending AIDS by 2030. Please give us your parting shots in 1 minute.
Okay, what I would like to say is we've been sponsored enough, we've been babysat enough. It's time we take up our responsibility, which means HIV is a medical condition like others, but different in the bit that it affects children up to death. Sawa sawa. So what we need to do is embrace what we can, find out where the root cause is, take the QI approach, that is for the global organizations, the networks. If you don't work on the base, the foundation, whatever strategies we are saying here are going to be meaningless because you're building roofs when your floor or your foundation is not done. So come back to the basics, please. Come back to the root where we are. Find out what has been happening since the declaration in January. Find out what we've been trying to do. Then what you can reinforce, reinforce. Where you can come in for us, come in. But where you can sustain strongly, do so as you plan for the long-term methods so that we can sustain HIV care and treatment beyond the third 90. Sawa sawa.
Thank you so much. Next, 1 minute, please.
Okay, so I'd like to say that the Let Community Lead talk should not just be something we put on our placards and banners and T-shirts and wear it all around. It should be something that we practice. We should have community-based services because it starts with the community. Every child belongs to a community. Every woman belongs to a community. So when you take this awareness down to the community levels, the local community, and even the religious community, faith-based communities, they are able to pass these messages, and we are able to work together to find solutions. And of course, we know that children are the future, so we have to really protect our kids. Thank you.
Okay, 1 minute, Reverend.
My parting shot. What can end AIDS among children? Nothing but a comprehensive love response. Multiplying, yes, and safe, and eliminating sin. Oh, precious is the truth that treats, prevents, and hopes in God. Nothing else that we know, nothing but a comprehensive love response. Hear this parting shot. The parting shot. If we do what we can, God will do what we can't. There is much in our history to give us hope and courage. Oh, precious is the truth that treats, prevents, and hopes in God. Nothing else that we know, nothing but a comprehensive love response.
Thank you so much, Reverend. And indeed, there is nothing apart from the love. The love. Okay. Can we give our panelists a bigger round of applause? I know some of you have questions, but please feel free to. We are really time barred. I don't know if Helena can allow me to take some 1 or 2 questions.
Yeah, 6 minutes.
Okay, 6 minutes. All right, can we have like 2, 3 questions? Okay. Okay, let's have, yes, the three of you. Please keep your questions short and brief.
Thank you so much. My question goes to Reverend Biamgisha. What is the message that you give to your fellow pastors, especially in the Pentecostal sector, the white garment churches? You find that they pray for people by laying hands, yet you know that the HIV virus is physical, and they actually entice people to throw away their treatment. So I just wanted to know your position as clergy, how you are tackling that problem, because it's really big. Thank you.
Thank you so much to amazing panelists. Mine is actually not a question, but just a reminder that you cannot take care of the child if you do not take care of the mother. Thank you.
Nice. Thank you, Sean. My name is Ludfin Bunde from UNAIDS. It's not a question, but a recommendation to GNP Plus. It is anchored on Elizabeth's presentation around integration. You saw how Elizabeth started. It's about rotation of healthcare workers, in the facilities, as an example of what she gave. And let me give you an example of my country, Kenya, because integration is now started off, and it would be happening in many other countries, particularly in this part of the world. So to GNP Plus, the question we will be asking for all of us is, what is integration from the perspective of a person living with HIV? What are the bare minimums that needs to go into the integration agenda? If this meeting can help us define that and give it so that communities in all their diversities, when they will be engaging with governments in various spaces, can push for that, then we'll have made a big difference to the communities that we serve. Thank you.
Okay, Reverend, I'm going to give you 1 minute.
One more.
Oh, okay.
Thank you very much. Mine is very specific to the Reverend. We started long ago, with you, many years ago. can you tell us how, as the religious organization, how are you going to be able to push for local domestic funding, now that we know that funding is going, specifically for children within the particular countries that you are working? Taking into account, you are able to meet the congregation at least once a week, and that's 4 times in a month, and you've got that power. And how will you also, as the religious leaders, start pushing for the AU, the East Africa community, and the SADC countries to be able to put in money for this particular issue?
I will start with that one. As a network, we are working with our supporters to ensure that a quadruple partnership exists or is developed. That partnership each of those partnerships have. For example, we are capable of raising resources. We build so big buildings and what, but you give us a project, and especially children. Children is a soft target for us. It will be so easy for us to engage with, and it will be an entry point into addressing other issues. But in terms of resource mobilization, if you said, give us, like any Friends of Canon Gideon Foundation, which I have not talked about today because this is not part of the agenda, but we have a program called 2K. Give us 2,000 shillings, 2K per person. If there are 5 million people giving you 2K, that's significant resources. But it will come only when we agree on the partnerships. What are you bringing on the table as faith sector? What are you bringing on the table as government? What are you bringing on the table as private sector? What are you bringing on the table as civil society with PHA networks and KPs? The second question was on treatment. How do you engage? We have 3 conversations happening with the faith communities, especially the Pentecostals, but also the conservative evangelicals and others. The first conversation is about the theory, the punishment theory of disease, which unfortunately was copied by even the medics. And you talk about don't smoke, you'll die of cancer. And we have mothers who have never smoked, but because they are living in environments where smoke is and other carcinogenics are, they get treatment and they get cancer. So that the punishment theory of disease punishes a person who should be helped. Why is love absent towards people who are positive? It's because people are blamed. You are positive because of what you did or what you didn't do. So we have that engagement of saying, we move away from that to a capabilities enhancement model. That if this KP or this child or this person is built the capacity to know how AIDS is transmitted, how it is prevented, and is given the tools, they will be part of the answer. The second conversation is on what is driving stigma. That for 40 years we are still talking about stigma. And we've discovered it is part of the messages we are pushing around in terms of controlling the epidemic. For example, the scientists in Uganda when they are preventing the data. Even in Kenya here, I was invited by Dr. Olago to speak to the religious leaders. And the person who started the conversation was saying the highest infections are among men who have sex with men. The second one is injecting drug users. And the third one is commercial sex workers. By the time they reached the third point, the religious leader had closed their eyes. Why are we lazy in producing that data? Why don't we say, what do the three have in common? They all lack information when they need it. They all lack love when they deserve it. Their human rights are violated. Why don't we talk about that and research? So that conversation is happening also. Why is stigma going ahead? The ABC have already talked about it, you know, where faithful people are stigmatized. Even when they are positive, they say, oh, they couldn't abstain. Then the last one is the treatment. What do you tell religious leaders who are telling people to get out of treatment? I take my medicines as if prayers don't work. And I pray as if medicines don't work too. Treatment is by God. Whether he uses ARVs or uses prayers, mine is to take what science has told me, because everything's from God. Then he will choose, or she will choose. I don't know the agenda of God. She will choose if she wants. Like me now, they ask me, what has made you survive this long? You know, I have had 15 surgeries, one of them for cancer and others. But I pray, I take medicines, I go for surgery, you know, and I take all the advice. So combination prevention works.
Thank you so much, Doctor. Can we give him a bigger round of applause? A bigger one, please. And that statement is indeed powerful. He takes medicine like there is no. Hello. And he prays like there are no. Wow. Please take your medication. Those pastors who are misleading our people, please tell them to stop misleading our people. At least let them adopt this messaging. Let them advise people to pray while they take the medication. But even the Bible says, for those who are Christians, you have to do something. Yeah? The Bible says that for us, I don't know how we can translate, maybe Doctor can help, Reverend can help me. Katonda yamba ye yamba. God helps those who help themselves. You have to do something for God to do it. And we also know that God gave the knowledge to those who did the medication, who manufactures the medication. So we have to, be thankful. 1 minute, in fact, 20 seconds. Yes. Are you loud enough?
I just wanted to add on the question that Samau asked. I think it would be very important for us to have clarity on what we want to push forward, so that we are able to give the faith leaders
we are able to guide the faith leaders come out on what to say, because again the other thing is to map out the areas where faith leaders have influence. For example, All Africa Conference of Churches have a special sitting at the AU. That's already a platform that if the AACC understood the issues that we are pushing from this meeting, and we get a sitting with them and we explain and we give them the necessary tools, it would be easier for us to engage at that level. So for me, two things: clarity on what we want in terms of integration, like Ludwin has said, what are we saying? And then number two, engaging with those platforms. We will go far. The faith leaders have the influence. They are already existing platforms that we can leverage on, but then we need to come together and appreciate what the faith leaders are bringing, and of course the capacity that's within here. And the last one is also to build the capacity of faith leaders. If we want them to engage in domestic resourcing, how can we help them understand the budget making processes and where to engage and with who, and we give them the relevant relevant tools, I believe they would be more than willing to be available.
Thank you. I hope those was 20 seconds. Anyways, let's give our panelists a round of applause as they take back their seats. Please take back your seats, and please also clap for yourselves for being a very vibrant, active audience this evening. I know afternoon sessions are always very difficult to moderate. People are satisfied, are tired, or what. But thank you for being active. Thank you for being a very wonderful audience. Last but not the least, please clap for the moderator as well. Okay, let me also invite Nathaniel to come and take us to the next session. Clap for Nathaniel as he comes.
Thank you. And it's the end of day brief session, so it's going to be very brief because we've had a long day. We've had lots of fruitful discussions and conversations. So we actually started last night with the opening ceremony where everybody came together, we met each other again, or we made new friends. We shared food together, and breaking bread is always very important when we meet each other and we get to know each other. We heard yesterday from NEFAC, who are our hosts here in Kenya. We heard from GNP Plus and our positioning on the PLHIV leadership. And we also heard from the Ministry of Foreign Affairs from the Netherlands and the support that they have for PLHIV leadership. And I'm going to quote my friend, my brother Tariq, who said, if you don't know where you are going, at least know where you come from. And that's what we did yesterday, and we did that today. We heard about the sustaining the HIV epidemic control beyond 2030. We heard from Dr. Mumbi Jola, Dr. Nuduki, and Andy Seal, and Jeff Eaton. And again, to quote Dr. Nuduku, funding of the past is the past. We can't go back to US government funding. It's not there anymore. We need to go forward, and we have to have a long-term plan as people living with HIV networks. We're looking at where are we now? These are the 4 questions. Where are we now? And where do we want to get to in the long term as PLHIV networks to get to 2030 and beyond and live? We did thematic sessions. We looked at PLHIV narrative changes, community health systems integrating into UHC, social enablers to promote testing, treatment and prevention to keep us alive. And we just heard from the religious leaders in the HIV response from the World Council of Churches. Tomorrow, it's very brief, I told you. Tomorrow we're starting at 8:45 in this room. Yes. And we're hearing tomorrow from VIV, UnitAid, Gates Foundation, AfroCab, Global Fund and CHAI. And then we're going to go into breakout rooms again into sessions, key sessions on women living with HIV, youth living with HIV, and people living with HIV. So we have that specific focus on our networks as well, because that's also key. We are diverse in our living with HIV. And then in the afternoon, we're going to have sessions with UNAIDS, where we're going to have a consultation on the global AIDS strategy. And that's why we're here as well, to start building that and telling the UNAIDS global AIDS strategy, where do we need to be getting to by 2030. And finally, thanks. I want to give thanks to NEFAC, who supported us in being here. Thank you. Also to the funders who supported us, VIV, the World Council of Church, WCC, World Council of Churches, Gilead, AIDS Fund and the Love Alliance, which AIDS Fund and GNP Plus are part of. My colleagues at NEFAC, who supported all of you in your travels to get here. We arranged this within 2 weeks. Within 2 weeks. My colleague, my brother Ada, who also helped arrange all the travels, he's from the Turkish people living with HIV, he's unfortunately unable to be with us this week, but he also supported. And also the setup of all these rooms, the food, the comms, which is going wild online. My colleague Helena, who stands there very quietly, but please give her a round of applause for these wonderful sessions we've had. And to end the day today, day one, we want to do a group photo. So Helena's going to lead us outside, and we're going to take a group photo before it starts raining in the beautiful gardens of this hotel, which is hosting us. So thank you very much, everybody. And we'll see you tomorrow at 8:45.
Just a moment. Apologies.
Just a quick one. This one is a heads up for the international delegates. Your beautiful envelopes of DSA are awaiting for you at the Menengai boardroom. So immediately we are done with the photo, let's head to the Menengai so that you can welcome them with warmth. Thank you so much. Menengai is the one that you remember the breakout session that we had where group 2 was. That specific room, it's called Menengai. Sorry, I'm laughing. For the Kenyan team, I know your concerns. Your M-Pesa will reflect tomorrow.
All right. As we wait for the M-Pesa, we request that while we're serving tea, there's a banner out there. Let's make the longest line we can, and we're going to take one awesome group photo.